Welcome back. With us is Dr. Shah, and he is with the Jeffrey Carlton Heart and Vascular Institute at Hoag. And welcome. Thank you for being with us
Thanks
today.
Thanks very much for having me.
So we had a little time before we had you on here to talk about, the heart and what are some concerns. And today we're going to be talking about the mitral valve.
Yes.
Right. So tell us where the mitral valve is.
Sure. So the mitral valve, it's on the left side of the heart. It divides the two chambers of the left side of the heart, the left atrium and the left ventricle. So it allows blood to pass from the atrium, which is a low pressure system, into the ventricle, and then when the heart squeezes, it prevents blood from going backwards. So it allows blood to flow out the right side of the heart. Okay,
so now what we were talking about beforehand is there's 4 valves. So 2 valves you can kind of get away with some medication, but the other 2 valves are really critical.
Right. Well, each valve has its indications for when you need surgery or not, but the valves on the left side of the heart, the aortic and the mitral, are particularly important for helping provide good oxygenated blood to the body.
Right, okay. All right, great. So as you mentioned, the mitral valve is on the left-hand side, and what is the function again? It's to pump the blood?
Yeah, so the valve opens and it allows blood to fill the left ventricle, which is the most important chamber, and then when that chamber squeezes, that mitral valve closes. Okay. So blood does not leak backwards and go the wrong way.
Oh, okay. All right, great. And so why do some people need to have it repaired?
Sure. So over time, the valve can break down just like other parts of your body. The leaflets can get holes in them or tears, or some of the cords that hold these leaflets in place can rip or get stretched out. So when that happens, the valve can start to leak more. And if it leaks more and more to the point where the leakage is severe and the person has symptoms, then that person might need surgery to fix that valve.
Wow.
Also, the valve can get tight over time as well. People can get calcium deposits or have infections that can break down the valve, requiring surgery as well.
Is there any particular age that people need to be concerned about this?
Not particularly. It usually is a disease of older people, so most of the time people in their 60s and 70s would be the most common, but sometimes we do see breakdown at earlier ages in the 50s and sometimes 40s.
And what are some of the causes of some of these breakdowns?
So one is just advanced age, just getting older is one thing. Sometimes the heart itself, if the heart muscle is having problems from low blood flow or getting weak, it can stretch out the valve and cause the valve to leak. Infections, and in the rest of the world, infection is the #1 cause of needing mitral valve surgery. It can cause the valve to get either too tight or leaky.
What kind of infections are you referring to?
Just bacterial infections like streptococcus.
Oh, wow. Okay. And then what about the way we eat? I mean, you and I were talking about how we're always so busy and we eat a lot of processed food and we don't have time for exercise. What are some of those things going to cause some of these problems?
The diet won't directly affect the valve, but if the diet leads to the heart muscle getting weak, then if the heart muscle gets weak, that can pull the valve and cause it to leak as well.
Oh, I see. Okay. So what are some of the approaches that we can, that you guys can do about replacement or repair?
Sure. So when someone has a valve that's leaking severely and they have symptoms, that's usually time for surgery. Surgery can be performed through a variety of different incisions. The kind of standard way is the median sternotomy, where we make an incision up and down on your chest, and that's kind of the gold standard, tried and true way to do it. Patients do very well from that, and they recover very nicely. Other approaches we can do to get into the valve are we can go from the side of the chest through a small incision, maybe 4 or 5 centimeters in length, and sometimes we can use the robot to approach the valve as well.
Right. And now you are fairly new to the community. Welcome.
Thank you.
And what is it that you primarily do?
Sure. So usually sternotomy through the middle is the kind of tried and true approach that I do at this point in time. As our volume builds and experience grows, and for picking the appropriate patients, then doing an approach to the side would be something in my repertoire as well.
Okay.
But the studies at this point in time haven't really showed a benefit of one way versus the other.
Oh, really? Okay. And then I know you had mentioned robotics, and that is something that is probably coming about more and more. What are some of the advantages or disadvantages of doing robotics versus the traditional way?
Sure. So yeah, Hoag, we do have a very large, robust robotic surgery program. I think we've done over 250, maybe 300 robotic cases in the past 10 or 15 years or so. The advantage of the robot are one, it gives you a really good view because that camera is right in front of the valve, so you can see the valve and its other structures very clearly. Whereas if you're doing it from the side without the robot, the valve is very far away from you, probably a foot away from you. So it can be a little bit harder to see.
Oh, wow. Okay. All right, good. And then Having, you know, such a wide variety of offerings from Hoag, what would you say are some of the advantages for people to look into Hoag for this type of surgery?
Sure. I think that the main advantage with Hoag is that we provide you know, approaches to the mitral valve from all different angles. We're able to do mitral valve repair, which is kind of shown to be advantageous over the long term versus replacement in some patients. So we can repair using a variety of techniques. We're able to replace the valve if it needs to be. There are some new percutaneous technologies where we can try to repair the valve without open surgery.
Oh.
We offer that. And then for the patients who do need surgery, we offer surgery through whatever option is best for them. So whether it's through a sternotomy, through a small incision from the chest and the side, or with the robot.
So is that something that the patient would obviously sit down with their primary care physician and their cardiologist to decide what is the best route for them?
That's right. Usually it's once they have the diagnosis of the mitral valve leaking or being tight, they would see us, and then based on their other comorbidities, their body habitus, their age, then we would decide which approach is best for them.
One thing that we were talking about also earlier before we had you on was my father, who experienced something in a high altitude situation, and it turns out that he did have to have some repair. So what would you say to our community about some signs that they should look out for?
Sure. So in regards to the mitral valve, shortness of breath is probably the most common symptom, and that can be caused from a lot of things, from lung disease to heart blockages to valve disease. But usually the most common symptom we see is shortness of breath.
Okay.
Swelling in your legs can be another sign when the fluid is kind of backing up and going the wrong way. Mm-hmm. Sometimes people have palpitations or feel an irregular heartbeat.
Right.
And sometimes people have chest pain.
Wow, so there's a lot of things, but then like you said, sometimes you can think that it might be something else and it's hard to detect.
Correct.
Okay, all right, well perfect. Well, thank you so much for the information. I appreciate you being here.
No, my pleasure being here. Thanks for having me.
All right.
Okay.
And remember, if you need something like this, you can always contact the Jeffrey Carlton Heart and Vascular Institute at Hoag. We'll be right back.